GLP meds like Ozempic and Zepbound have completely changed the national conversation around obesity management. All kinds of headlines are coming up like these. Ozempic, amazing weight loss. Zepbound, even more amazing weight loss. Obesity is actually a medical condition. That's a headline that's shown up. And the GLPs have changed the national conversation about many obesity-related conditions. Here's some more headlines. Ozempic reduces cancer. Ozempic reduces heart attacks, reduces heart failure, reduces kidney disease, reduces dementia, treats addiction, fatty liver. Take Ozempic for migraines. Take Ozempic for knee pain. I mean, really, GLPs are on a roll, and there are so many positive outcomes from the GLP medicines that, understandably, there's become this perception that they can be expected to defeat the obesity medical condition solo. GLP prescriptions are surging, there's no surprise. Look at this graphic from Fair Health, which shows the blue line of surging GLP prescriptions, while bariatric surgery is the shrinking green line at the bottom. And also notice that even in 2024, only around 10% of people with obesity disease were getting treated. So while we bariatric surgeons may be kind of sad that the GLP medicines are taking our cases, we can appreciate that GLP medicines are changing the national conversation around the obesity disease. There seems to be this thought process, well, if this thing can be treated by meds, it must be a real medical thing, an actual diagnosis, right? So gradually we're moving away from this idea that the obesity disease is a matter of choice, a moral failing, a lack of discipline and that kind of thing, and better understanding it as an actual metabolic medical condition. These GLP medicines really are amazing, a huge leap forward, but we bariatric surgeons are a little bit salty. We've been singing this song about metabolic disease since the pioneering days of bariatric surgery. Check out this research paper published by Dr. Walter Porres in 1995, blazing a trail in print that the metabolic obesity disease is a problem with energy hormones, not just a set of poor choices and a lack of discipline. But no one believed the surgeons. They would only change perspective once they saw these medicines have these amazing effects. And check out this diagram that we call metabolic woman. All these disease conditions on the right column are vastly improved with bariatric surgery, including classics like diabetes, high blood pressure, high cholesterol, migraine, headaches, stroke, etc. I mean, we surgeons do more than help people lose weight too, right? Not just the GLPs? Okay, you get my point. But I'm not actually all that salty because I love that my patients have more options for treating their metabolic obesity disease. And I love that the meds are leading my medical colleagues and society overall to a better understanding about these metabolic obesity diseases as medical conditions, moving away from and shedding that old blame-based obesity as a choice paradigm. And I think that the meds are also leading us all to a deeper understanding about the root causes or the core shared causes of these multiple metabolic diseases, not just the weight, but diabetes and blood pressure and cholesterol and lupus and the inflammatory diseases, and a better diagnosis or ability to diagnose the details of the disease, because it varies from individual to individual, so that we can actually learn to treat the root cause in each individual patient by offering them the right treatment. And it turns out to be the case that as everyone gets more practical experience with the GLP medicines, they're finding, not surprisingly, that the medicines aren't quite as impactful as surgical treatment. Check out this bar graph that shows relative weight percentages lost with each of these treatment options. And notice that lifestyle treatment alone leads to about 5% weight loss, that the medicines are clearly better than lifestyle alone, and that gastric sleeve or gastric bypass have a greater impact than the modern weight loss meds such as Wegovy or Zepbound. Now, a key note, this graph is based on stats from the FDA trials for Wegovy and Zepbound, but so far in real-world use, these medicines seem to be about half as effective as they were presented on the graph. So no big surprise, we're seeing that it was kind of unrealistic to expect the GLP medicines to handle this whole obesity condition on their own. Patients have already experienced that the obesity disease is one of these conditions that sort of fights back, meaning that the more weight you lose, the more the body fights back or tries to pull you back to where it thinks you're supposed to be. It's harder to lose more weight or even to maintain that lower weight that you've achieved. So folks are also seeing that the meds have long-term costs and side effects, just as surgery has costs and side effects, but these are different. And so that, in my mind, means that these options should work synergistically rather than antagonistically. Just to say it again, I think the GLP meds are a fantastic addition to the toolbox for treating metabolic obesity disease, but I think it's too much to expect meds to get the job done all on their own, certainly not sustainably for life for most patients. It seems to me that patients get the best shot at this integrated long-term obesity management plan only in the context of a specialty clinic or a specialty group of doctors who are dedicated to treating the obesity disease and its associated conditions. It can be pretty complicated to know what to start with and when is the right time to transition from one strategy to another and when it's time to weave a couple of strategies together. Right now, I think that only teams who are focused on the latest science can work with patients to make the best choices in terms of risk versus benefit, cost versus benefit, and sustainability. So yeah, we bariatric surgeons have been a little salty to have been singing our metabolic management tune for a couple of decades and then to have a cover of the tune become so much more popular. But the fact is that meds and surgery can be a great team if they harmonize. So let's go that way. And I wish you the best of luck on your journey.